Okay, this is my intramuscular injection in the deltoid. First, you want to make sure that you know your 6 rights of safe medication administration, which are right patient, right medication, right dose, right route, right time, and right documentation. Always perform hand hygiene, washing my hands. I'm going to check the MAR, which says my patient is to receive Pneumovax 1 milligram intramuscularly now, and my vial contains Pneumovax 2 milligrams per milliliter. So that means that my patient is receiving 0.5 milliliters of the Pneumovax. So I can roll this in my hands to mix it up, and I need to check dates and expiration dates to make sure that it's good to go. Remove the cap and take an alcohol swab and clean the top. Dispose of that. I need to select the correct size of syringe and remove it from the container. Okay, I'm going to remove the cap carefully, pulling away from my body and placing the cap on a clean surface. And then I'm going to draw up the 0.5 milliliters of air into the syringe. So I got 0.5. And insert the tip of my needle in. Insert the air. And then at a 90 degree I can tip this up and pull back and tap to get rid of any air bubbles. Make sure it's at 0.5. Okay. Got rid of all the air bubbles. Remove the needle and do the one-handed recapping. Swooping. So I got my medication ready. I'm going to go into my patient's room. Hi, my name is Maddie. I'm going to be your nurse today. I'm here to do your deltoid injection. I'm going to wash my hands and put on gloves. I'm going to have my patient identify themselves. Can you tell me your name and date of birth? They'll tell me their name and date of birth, and then I'm also going to check their wristband to do 2 patient identifiers. Alright, I would instruct the patient to expose their whole upper arm and to either relax their arm at their side or to set it on like a table or something so it's relaxed. I'm going to take an alcohol swab and clean the area in a circular motion, working inward and going outward in a circular motion. Throw that away. And then I'm going to take my 2 fingers from the top of the shoulder and make a V, and then the injection's going to go right in the middle of my 2 fingers. So I'll do that on my patient. Got my 2 fingers, it's going to go right in the middle there. Remove the needle or the cap and check. I got my 0.5, so I can hold this taut with my 2 fingers, and it's going to go right at a 90 degree quickly right in. And you can check for blood return, so I'm going to pull back, and if there's no blood within 5 to 10 seconds, then I'm good. Otherwise I would remove the needle and remove the medication and start again. But now I'm just going to inject this at a steady rate over 5 to 10 seconds and remove my needle. I would dispose of the needle without recapping, but in this case I'm going to recap because I don't have a sharp spin. Dispose of my needle, and I could put a band-aid on here or apply a tiny bit of pressure with a gauze pad if there was any bleeding. Put a band-aid on. Remove my gloves. Wash my hands. make sure my patient is comfortable, check if they need anything, make sure their call light is within reach, and then I would go to my computer and document the time, the dosage, and the location of the injection.